Hi guys. So a disc bulge is not a death sentence. So what we'll look at in this video, just look at one passive tool that we can use to help a disc bulge or herniation begin to heal. Things to remember, this tool is kind of part of the overall approach you'll need to follow, because if you've got a posterior disc bulge or a herniation, we know you've got a problem with too much compressed flexion. So the most important thing is going to be to identify that aggravator, where that sort of occurs either in day-to-day movements or training, and remove that first, because that's obviously basically keeps picking at the scab. So we need to remove that. It's probably the most important thing we do before we even begin to think about sort of active and passive treatments and approaches to helping the disc heal. We've got to first remove the thing that's created the problem and the injury. So a disc bulge can be a great tool. It's a great passive way, great passive position to be in to help a disc bulge or a herniation begin to heal. And the reason is because a posterior disc bulge or herniation is caused by compressed flexions. That's rounding of the lumbar spine, particularly under load. So if we put it into unloaded, gentle extension, basically the reverse mechanic, that's going to start to pull that disc bulge or herniation back in to the disc to help that healing process. And again, if we do a great job avoiding our aggravator, so compressed flexion, that's going to let it start to gristle, harden and heal up. And the work of the passive extension, which just helps it kind of pull back into the disc a bit more and kind of speeds up that healing process. But again, most important thing, you must remove the cause of the initial damage. You're going to kind of be spinning your wheels and getting nowhere. So let's have a look at disc recovery position. Disc recovery position, we have a few different variations, and it gives us a bit more scope to kind of tailor things to suit people, so we can balance out sort of the reward of having the disc heal versus the risk of irritating other potential problems. So again, this isn't going to work for everybody. So those who already have facet joint irritation or problems, or possibly certain muscular imbalances, you've got to be a little bit careful with this position because it might exacerbate those conditions. But for those with just a fresh disc bulge or herniation, this is going to be a useful tool to kind of add. And we can do it a few times a day. The idea is to do it sort of 3 to 5 minutes or so, just to help that kind of bulge or herniation start to get pulled back into the disc and help the healing process. So the first level, nice and easy, is just 2 flat palms underneath your head. And what I'm going to do in that position is basically stay for 3 to 5 minutes, and the idea is to let my spine relax, take some nice deep breaths, and my spine relax to the floor. So for some people, you might feel a bit tight because you've got some muscular tightness in your spine, getting into extension. Eventually that should iron out. So what we're looking for ideally is no pain. If you feel like pain is getting worse, we need to definitely come out of that position straight away. So level 1 is just 2 flat palms beneath your forehead. And we just stay here for 3 to 5 minutes. Let our spine to relax towards the floor. Let our discs reset and start to restore some natural extension to our spine. So if that feels pretty good, we can then start to progress it a little bit and find the right level for you. So next level from there is just to come up with one fist underneath your chin like this. And again, 3 to 5 minutes, see how your spine responds. Might feel a little bit tight initially if it's muscular, and then start to subside. If, however, it's an increase in pain over time, or for some people this may irritate sciatica. If you've got sciatica, it's caused by facet joint irritation. We need to pay attention. If that starts to get worse over time in this position, this is not going to be the tool for you. But if that feels pretty good, 3 to 5 minutes, we can then try 2 fists underneath your chin here and see how we feel here. So I'd say for most people, this is probably as far as you ever need to come. And this is, pretty much a very age specific thing, how much extension you can get into. But for a lot of people, getting to here is going to be the absolute maximum they ever really need to get to in terms of extension. After here, the risk versus reward ratio gets a bit blown out of proportion. But if, however, you want to get a bit more extension and you feel good doing so, the next stage from 2 fists is to come up onto your forearms and elbows like this and get a little bit more. And again, those are facet joint irritations or certain muscular imbalances. This is going to be a bit, way too aggressive for them. Okay. So it's in stark contrast to those that are familiar with the McKenzie approach. People do sort of like a floppy push-up and come right up to here as like a prone cobra. Just for most people, that's way too aggressive. And if you've lost between 70, you've got less than 70 to 80% of your disc height left, there's a danger you're really going to start to cause some damage to your facet joints, but also being in that aggressive position isn't going to give you any benefit at all into helping the disc actually heal back in. So far better to stay on those lower versions, so from 2 palms, 1 fist, 2 fists, is probably where most people want to be, because you'll get most of the benefits with nominal risk. But again, not going to work for everybody. You need to try it and see if it's the right tool for you, because again, we're always governed by a right tool for the right person at the right time. But for those with fresh disc bulges and herniations and no other issues, this can be a useful tool to help those disc bulges start to heal and get pulled back into the actual disc itself. So give it a try, be careful, see how you go.